Welcome everyone. Apologies for the very late time for this, due to a very overrunning previous meeting. Without further ado, I am Councillor Matthew Winnington, Cabinet Member for Health, Wellbeing and Social Care. If the continuous fire alarm sounds, please evacuate the room, and public gallery by the stairwells. Do not attempt to use the lifts. Please assemble by Queen Victoria's statue in Guildhall Square. In order to comply with the Guildhall Trust Fire Marshal regulations, anyone who signed in at the Guildhall reception desk should sign out when leaving the building at the end of today's meeting. Members of the press and public are also permitted to record the meeting on the understanding that it neither disrupts the meeting nor records those stating explicitly they do not wish to be recorded. Please can everyone use the microphones and remember to switch them off when they have finished. So I'll just go around and have some instructions. So start with you, Brian. Yeah, name yourself and switch your microphone on.
Brian Madgwick, I'm councillor for Portsgrove. Thank you.
And your party?
I'm a Portsmouth Independent Party. Thank you.
Thank you, Brian. Yeah, just for the benefit of anyone watching. Lewis.
Afternoon, Councillor Lewis Gosling. I'm the Conservative spokesman for Health.
Thank you, Lewis. Yinka.
Yinka Deniro, Councillor for Charles the King's Ward, Labour Party, and Labour Opposition spokesperson for Health, Wellbeing and Social Care. Thank you.
Thanks, Yinka. Andy.
Thank you, Chair. Andy Biddle, Director of Adult Social Care.
Thanks, Andy. Matt.
Thank you, Chair. Matt Gummerson, Head of Strategic Intelligence, Public Health, Portsmouth.
And Anna.
Anna Martin, Democratic Services.
Thank you, and we have Josh from the news at the end of a very long day, I think, for you. So hopefully we won't be too long. Okay, so we don't have any apologies for absence. Were there any declarations of members' interest? Okay, I do have a declaration of members' interest. It's a non-pecuniary interest, but one for information. I work for Solent Minds, which has some involvement with mental health Section 75 agreements, however, not ones that are referred to in this report. So, without further ado, Andy, adult mental health Section 75 agreements.
Thank you, Chair. The paper's before you, so I'll do a brief summary, starting at page 1 and dealing with sections 1, 2 and 3. So the purpose of the paper is to seek approval to implement a new Section 75 agreement for the Integrated Adult Mental Health Service in Portsmouth. And Section 3 provides the background to the legal mechanism and the previous long-standing working arrangements that have existed in Portsmouth. This section also sets out the mechanism for monitoring provision of the agreement and the history of this new agreement, which was delayed due to the COVID-19 pandemic and service capacity. Moving on to page 2, section 4 highlights the broad outcome of an integrated service for Portsmouth residents and includes feedback from events with people who use services, people with lived experience around maintaining our integrated provision and their feedback around that. Moving over into page 3, the section sets out the partnerships involved in service provision and the working methods involved with working in our residents. Over the next 4 pages, 3, 4, 5 and 6, we have got some extracts, statistics and a case study taken from our Partnership Management Group Q1 report for 2022-23. This illustrates our learning and development for staff, the link that the service has with housing provision in the city, and the reporting criteria for the arrangement. The case study on pages 5 and 6 is reproduced with kind permission by the gentleman's family, by EE's family. It's a really important thing. It shows the impact that early traumatic experiences can have on any of our residents, on any of members of society. But it also demonstrates what positive integrated support can mean to our residents, how it can help, and how it can help people achieve. And I guess in many ways the case study is the most important part of our report as the outcome of all of our work that we do together in Portsmouth. On page 6 of the report, the plans for the service to increase the way that we co-produce, the way that we plan services and deliver services with our residents, our partnership working, access and work with those who transition from children's to adult services is also outlined there. And the governance and audit arrangements for this particular arrangement are laid out. Then on page 7, the remaining sections of the report draw out the integrated impact assessment, legal and finance comments. It's worth drawing attention to the legal comments. We've got a number of services that provide integrated care and support led by either the council or the NHS in Portsmouth that work as part of Health and Care Portsmouth. And the reason we work together in that way is that we believe that partnership working can take down walls between organisations so that people experience better care, seamless services and receive the support they need. These arrangements, many of these arrangements have been in place for some years, but we've had a recent challenge to consider around whether the practice of seconding colleagues from either organisation is the right way of achieving those aims. So we do still need to work through that detail, but we don't believe that that should stop our working in partnership. So the recommendation for the paper is therefore for Cabinet Member to agree to myself as the Director of Adult Social Care entering into new Adult Mental Health Section 75 agreement for a period of 3 years from the 1st of October 2022 and to ensure a legally compliant staffing model has been agreed, all the risks noted. And that's a summary of the report, but happy to take any questions.
Thank you, Andy. Lewis.
Thank you. Just a few points from me. Firstly, just to say how much I support this. I think we've sat in here before and talked about how important integration is and how important producing services along with service users is, so it's great to see both of those in there. And for me to see the case study in there actually probably makes this one of the better reports that I think I've read. A lot of the times we read reports and it's red tape that we have to go through, or we have to go through a process, but this kind of actually links back what this process is leading to. This is leading to us enabling residents to get the help they need, and I think it's really important that we draw attention to that. So thank you, Andy.
Thanks, Lewis. Brian.
As we spoke earlier in private, I think the case study is something in my 70 odd years I've never experienced, as close up as has been detailed there. And when we talk later meetings and that, I'd like to get more involved, which I've told you about. And I think, for the want of a better word, ordinary, I think the young man in question here could have had an ordinary life if his childhood had not been so messed up. And maybe we need to look into early care more than we do now. But certainly very impressive, thank you.
Thanks, Brian. Yinka, did you have any comments?
I went through it and I read the agreement, which was okay to me. But I just want Andy to actually explain further on, because they say, okay, once a legally compliant staffing model has been agreed, so how? Then when is it going to be ready? Because this is going to take place 1st of October 2022, and we're in September now. So when do we have that? Thank you.
Thank you. I think we'll either be talking about doing something different than a secondment, or we'll be noting the risks that we've been advised of seconding colleagues across, but stating that we accept those risks, we note them, but we still feel this is the best way to operate. And so in that way, we feel we'd be compliant. So we will intend to operate this from the 1st of October. In common with all of our other services, which is where we use a secondment agreement for colleagues either who work for the NHS Trust to be led by the City Council, or for colleagues who work for the City Council to be led by the NHS Trust. So I think it will be a matter of noting that there are concerns, but still considering that we are compliant in how we work.
Thank you.
I'd just like to thank Andy and David and Dominic for the reports. I think it's a really powerful, as the others have said about the case study, a powerful show about how important integration is. As it looks at within the reports, we last looked at this. I looked at this myself 3 years ago. With an extension, and obviously that was also within the context of we knew there were changes coming in terms of the integration picture, in terms of what was then the STP and is now morphed into the ICS, that we knew that was coming on the horizon, and that obviously that was in need of a real difference of approach. Andy, can you just let us know how the end of the how the coming of the integrated care system for Hampshire and Isle of Wight has impacted on the approach we've taken for this new Section 75?
Yeah, certainly. I think prior to the ICS coming to being on the 1st July this year, there were concerns for those of us that work collaboratively at a local level that those services and those arrangements might be disrupted. So what we did in the run-up to the 1st of July was work with the shadow nascent ICS, if you like, that was being formed as an NHS organisation, and talk about the model that we use in Portsmouth and talk about the importance of working in the place of Portsmouth with those integrated arrangements. So we've worked cooperatively and collaboratively with the ICS and with the ICB, the Integrated Care Board. And so we're now in a place where we've renewed our overarching Section 75 agreement between the NHS and the local authority, and we're putting into place more detail in something called the schedules that sit underneath that govern our individual services, and that's with the blessing and the support of the ICB, the ICS, and so it's very much a joint enterprise. It's our model in Portsmouth, and there are similar models in other places in Hampshire. Echo the spirit of the legislation that brought the ICS into being. Integrated, is key to those arrangements, and so the work that we're doing in Portsmouth fits with that model and is supported. We're working at the moment to understand, now that the ICS is legally enacted, how we then work in terms of alignment of budgets and those other arrangements and agreements. But we have the support of the ICS to continue working in the way that we are, and indeed to take that further in terms of integration and alignment of services.
Thank you, Andy. And just to add to that, we had a meeting last week where both the chief executives of Southern Health NHS Foundation Trust and Southern NHS Trust were taking us through their proposal that they would merge. And one of the positives that I was really pleased about, which I had some anxiety about, so I brought up on behalf of the council and the administration, was about the fact that we might lose that local place model of delivery should they merge, because obviously so NHS serve only Portsmouth and Southampton and Hampshire, and Southern NHS Foundation Trust cover the rest of Hampshire. And I was really pleased to hear that they were not just about place was their first place, the sense of place. In our case, that's Portsmouth, was the first call on where they saw things being and then going upwards. But they were also very, very much. They were very praising of our integration locally, and they saw that as a model that should be taken on elsewhere in Hampshire, Isle of Wight. So that was really encouraging, and I think by moving on this Section 75 now, which is prior to any merger, that if those were just warm words, it makes it very difficult to untangle that integration that we're putting forwards now, seeing as if we're looking at this being a 3-year Section 75, that would cover beyond the time whereby they would actually come together. So, but I think that's, for me, that's encouraging, and it just goes to show that the work we're doing on this Section 75 now will hopefully not be changed should those two organisations eventually do come together, which they may or they may not, but that's certainly their intention at the moment. But so the recommendation on this is that the Cabinet member delegates authority to the Director of Adult Social Care to negotiate and enter into a new adult mental health AMH Section 75 agreement for a period of 3 years from the 1st of October 2022 once a legally compliant staffing model has been agreed. And I am very happy to support that recommendation. Okay, so item number 4, Adult Social Care Annual Complaints Report 2021-22. Back to you, Andy.
Thank you, Chair. So in page 1, going through sections 1 and 2, the purpose of the paper is to provide an analysis of complaints and contacts for adult social care in the financial year 21-22. Section 2.2 sets out the numbers of complaints and contacts against the number of people that receive a service from adult social care. And moving on into page 2 sets out the areas and subjects of complaints. And then going into page 3, there's some examples of the complaints that we received just to illustrate. On page 3, section 2.3 demonstrates the performance against the procedure and notes improvements in response time for the 21-22 year. And then on into page 4 and section 2.4 details referrals to the Local Government and Social Care Ombudsman for that year, and section 2.5 the advocacy arrangements in place for complainants where those are appropriate. Section 2.6 further sets out the proportion of complaints upheld and notes the increase in those upheld in this in these statistics. Moving through into page 5, section 2.7, this notes complaints management for integrated services being reported differently, and 2.8 complaints received, with 2.9 detailing the one resident where the persistent complaints policy was invoked during that year. Pages 5 and 6, section 2.10 details the increase in recorded councillor and MP inquiries, and section 2.11 gives 3 examples of how learning from complaints impacts on practice, with section 2.12 detailing training activity. And then on the final pages, section 2.13 sets out a summary of the annual report with improving performance and increasing complaints being upheld and improved recording protocols. As an addendum, although this isn't in detail in the report, we asked at briefing for a breakdown around those financial complaints around financial issues that were received. So the complaints system currently groups all finance-related complaints under the FAB Finance and Benefits team. But that includes quite a range of services: billing and debt, deputyship, appointeeship, direct payments, as well as the finance and billing team itself. So what we're intending to do for the next report is to ask the complaints team to give us increased categories so we can be a bit more precise in those elements of the financial process people are complaining about. And just as some detail around that, of the 11 complaints that were categorised as finance and benefits, 5 are upheld, 3 partially upheld, 1 not upheld, 1 withdrawn and 1 not categorised. 2 were related to finance and benefits, 1 was related to an assessment carried up in a hospital, 5 were related to billing and invoicing, 1 related to problems around direct payments, prepayment card, and 1 a complaint about the assessment policy. So the broad spread of those is that of the billing invoicing issues, some of these are to do with process, allocation of payments to an incorrect payment site within the system, and an inability for arrears to be collected by direct debit. So we're working with our central finance colleagues in the council to address some of those, because some aren't in control of the directorate. That's just a little bit more information on the finance-related complaints, but happy to take any questions.
Thank you, Andy. Any comments or questions on this one? Okay. Just a slight comment from me. It says thank you again, Andy, for the report on this. I think it's comprehensive as ever, and I think it gives you, and thank you for that extra information as well. It does give a really good breakdown of the of what we are doing and being responsive towards complaints. I think we always have to make sure that we're doing that well and properly, and I think those making sure that councillors and the MPs are more aware of making sure that they can make themselves known, and we are recording those and making sure that they're recorded as being from those public servants in that way is really positive. I will just bring up the thing I did at briefing just about compliments. Obviously, that I would bring out that the compliments are very low, only 16 compared to 19 the year before, which was also very low. We all know how hard our staff work within adult social care. We know that actually they will get a lot more compliments than that, and I also know that they often don't record them as they just think they're doing their job. But indeed, so I've asked Andy if we could look to getting a bit more of a mechanism within the teams to actually record those compliments, as we know that actually for so much work that our teams do, that they are very grateful for the work that's done. And I think it's only right that they should be recognised in when we have this annual report coming through about, yes, people are going to complain, and they're absolutely right to complain when things aren't done right, but also that our staff should record when they do get compliments, when they get people who, if they weren't doing the job they're doing, the families would often be really bereft and are really, really grateful for what is often the most difficult times in being at their side, walking them through things and supporting them. So, but yeah, thank you so much for the report. Very happy to note it, and many thanks to all the staff who are involved with dealing with complaints, and also for all of those who are complimented and remember to record it as well. Thank you very much. So on to last item on the agenda. Matt, Public Health Annual Report, over to you.
Thank you, Chair. Here presenting on behalf of Helen Atkinson, the City's Director of Public Health. Don't know what I lost there. So yeah, this is presenting her statutory annual report, which this year looks at the key demographic and population health trends for the city. So Appendix B is the full report, which I don't intend to go through at length today, you'll be relieved to know. And effectively that acts as our joint strategic needs assessment annual summary as well. It provides a fairly detailed overview of key issues across a whole range of, as I said, population health issues, and it will be used by partners throughout the system to inform planning and policy making. It's also underpinned by more detailed analysis on each of those topics that then feeds into that report. We don't publish all of those pieces of analysis, but they are available on request. So if people want a more detailed look at any of the topics covered within that annual report, for example, some of the long-term conditions, we can provide that. There's an email address in the report to contact my team to access those. What we have produced, Appendix A to the report, is a more public-friendly summary. So it effectively takes the information in the executive summary and presents that in a more accessible way. At the time of publication, that was still in draft, and we were missing the infographic that's on page 3. That's now available. So if you go on the council website on the JSNA page, the version that's on there now has the infographic as well. And what that does is just pulls out some of those key facts and figures from the report. So just to highlight a couple, be very well familiar that life expectancy in Portsmouth is lower than in the rest of the country as a whole, and indeed with breakdowns within the city, healthy life expectancy, so the number of years you can expect to live in good health, is around 15 years shorter in the more deprived parts of the city compared to the less deprived parts. The main causes of that life expectancy gap, again, well known: cardiovascular disease, cancer, respiratory diseases. Rates of all of these are significantly higher in Portsmouth than in the rest of the country. And we know the factors that contribute those, things we can change in our environment, risky behaviours, smoking, alcohol, physical activity, that can all improve this. So that's the kind of thing that we're setting out, those key messages that are in many ways well rehearsed but still really important, and ask you to note the report.
Thank you, Matt. Lewis.
Just a quick one from me. Again, I know I've seen this a couple of times now, but just to, again, pass on my thanks to the team. And I think seeing the executive summary now finished with all of the infographics is really good. It's really useful for us as members when we're talking to other members, maybe from other areas as well, to kind of have some clear, succinct messaging. And it's, personally for me, it's handy to be able to steal that from the work you've done. If it's been done once, why duplicate it? And it's all, like you say, all the information is there. And yeah, I'd advise everyone to have a good read.
Thanks, Lewis. Any other comments or questions? Brian, go on.
It's only just the fact that I'd like to back up what's just been said there. It helps us all, and the more information we get, the better. And that's there's a lot of information there. So thank you very much.
Thanks, Brian. Did you want to come in, Yinka?
I think it's well explicit enough for me.
Okay, that's fine. Yeah, just to reiterate, as with colleagues, thanks so much for all the work that's gone into this report. I know how important it is for us to have this out there anyway for the city, but also as has been pointed out for our partners in particular. We've had in some of our partnership working within the integrated care system in particular, and with other partners, including the NHS, voluntary and community sector, other councils as well, other people we're working with from across, including businesses as well. It really does help them in terms of developing a lot of those strategies that people are doing now, including their environmental strategies, including their travel to work strategies, including making sure that that the right things are targeted in the right area. It really does make a huge amount of difference. But it also shows within the. I was having a discussion actually earlier with a councillor from Dorset on a completely different context, but and we were talking and we got on to demographics about social care, and of course having this information shows how different our demographics are from Dorset Council, but also it shows where we have some real need that they don't as much, and vice versa. So for example in Dorset, of course, they have a much older population, but they have a much less of a younger population, and therefore the strain on our children's services, for example, is much greater than theirs, and vice versa for adults in comparison to each other. And I think some people think it's obvious, but actually you really have to draw that out. And of course the government, when they're allocating funds, when they're looking for areas, when we're bidding for things, we really need this information. Information, as Brian said, absolutely, you can never have enough. So thank you so much for that. And it's, as ever, it's a really, and it's really good as well because it compares, we do a lot of comparisons to Southampton because they are our statistical and near neighbour, but we also compare to those other places in our vicinity, which do show those real differences. So that really helps us. And again, we were talking about integration. It helps us in terms of making sure that we get the right kind of support in our area, and indeed in the different parts of our area, to make sure that within that wider system that our voice is heard and our voice is acknowledged. So thank you so much. I'm very happy to note that report. That concludes this meeting then, so thank you very much. Did it in less than half an hour, so we didn't keep you too long, and especially for Lewis, who I know has been in there for some considerable time longer, and of course Josh. So thank you very much everyone.